The Ghana Health Service last week warned that it feared treatment centers will be full this week if the rate of COVID-19 infections continue. The Comfort Teaching Hospital and the Kumasi South Hospital are the two main treatment centers in the Ashanti region. Speaking to City News, the Ashanti Regional Deputy Director of Health Services in charge of public health, Dr. Michael Roxinejay, says since the rate of infections has not reduced, they have allowed some other health facilities to support in providing treatment for persons with moderate and mild cases to augment the efforts of the treatment centers.
Currently, the two main treatment centers, Convanoche and then Kumasi South, are not full, but they are hitting the brim. And the reason they are not full is that we've already started to take off the pressure from these two facilities so that the periphery, that's the district hospitals and polyclinics, and some private hospitals can also manage cases in a bit to soak up the pressure. So that is what is happening now. And that's the reason why that's the reason why Governor-Che and Kumasi South are not full yet. But they have some few beds to go.
Last week, the Ashanti Regional Minister, Samuel Osemensa, directed security agencies in the region to ensure the strict compliance to the COVID-19 safety protocols following a surge in cases. He also called on metropolitan, municipal, and district chief executives in the region to ensure the strict compliance to the protocols in their respective assemblies. Checks by City News at major areas in Kumasi showed that enforcement in various parts of the region, as directed by the minister, was yet to fully take effect. Although some police officers were occasionally seen engaging in the enforcement in few areas, City News checks at the Ashanti Regional Police Command show that there had not been any directive for the officers to officially begin the enforcement. Dr. Michael Roxinejay stated that although some police officers have begun the enforcement in some areas, they want authorities to extend it to many parts of the region in order to make a greater impact.
We need to still step up with strengthening the enforcement. And realize that secondly, the enforcement is mainly limited to the central part, or let's say the greater Kumasi area, what happens in the periphery. So these are all things that all of us have to join. That is, the various assemblies, securities everywhere would have to come together so that we do the same thing at the same time to ensure that we limit infections.